Good morning, wherever you are. This is Alina Park from ConferenceHype. Our segment will focus on 1 hour batch 0100 UTC, impact of premedication de-escalation on incidents of infusion-related reactions with daratumumab. Card 33. Etha Vale is covering JCO oncology practice. The topic is impact of premedication de-escalation on incidents of infusion-related reactions with daratumumab. Background: daratumumab is an anti-CD38 monoclonal antibody used to treat multiple myeloma and light chain amyloidosis. Methods: a retrospective chart review at the Mayo Clinic reviewed eligible patients with multiple myeloma or amyloid light chain amyloidosis who received their first dose of daratumumab within the 4 months preceding the date of implementation, or no more than 4 months after the date of implementation on April 13, 2022. Results: nearly all patients received daratumumab by SC route of administration. Discussion: omission of premedications after cycle 1 of daratumumab did not increase the incidence of infusion.
This is Conference Hype. Stay with us, coverage continues.
Card 31. Orion Reed is covering JCO oncology practice. The topic is unmet social needs among cancer survivors who were concomitant caregivers, a cross-sectional analysis of the Health Information National Trends Survey. Background: this study aimed to examine the impact of social determinants of health barriers, including food, housing, and transportation insecurities, on cancer survivors who also serve as caregivers, compared with cancer survivors only, caregivers only, and the general population. Methods: data were obtained from the 2022 National Cancer Institute Health Information National Trends Survey, which collected information on SDOH outcomes, including food, housing, and transportation insecurities, as well as participants' comfort level in sharing their SDOH concerns with providers. Results: overall, 49.1% of dual roles reported facing at least one form of food, housing, or transportation insecurities. Discussion: our study highlights the significant unmet needs of cancer survivors who also serve as caregivers, as they face higher levels of SDOH barriers than both the general population and cancer survivors only. This is Conference Hype. Stay with us, coverage continues. Card 32. Riley Knox is covering JCO oncology practice. The topic is timing of immunotherapy in practice, feasibility and impact of morning checkpoint inhibitor administration. Background: immune checkpoint inhibitors are a core mainstay of cancer care. Methods: in routine practice, the time of day of administration of ICIs invariably is not stipulated in the clinical notes. Results: thus, treatment timing of administration is mainly dictated by constraints related to the organization and planning of the outpatient infusion centers, the clinical pharmacy, which reconstitutes the parenteral drugs, and the patients themselves. Discussion: a growing body of evidence, recently including a prospective randomized trial, has shown a significant halving of risk reduction of an earlier death by early rather than late to DA of ICIs in patients with 10 different advanced cancer primaries.
This is ConferenceHype. Stay with us, coverage continues.
Card 29. Sage Harlan is covering JCO oncology practice. The topic is survival after fertility-sparing surgery for early-stage cervical cancer compared with non-sparing surgery, a nationwide comparative study. Background: the oncologic safety of fertility-sparing surgery in young women with early-stage cervical cancer is largely based on retrospective data from small series, highlighting the need for larger studies to validate its safety. Methods: we performed a nationwide retrospective matched cohort study of all patients, age 18-45 years, with Fédération Internationale de Gynecologie, et d'Obstétrique 2018 stage, IA1 to IB2 cervical cancer, who underwent fertility-sparing surgery, FSS. Cone biopsy, large loop excision of the transformation zone, or tricholectomy, between 2000 and 2022 in the Netherlands. Results: in total, 1,446 patients were included, 482 treated with FSS, and 964 with a hysterectomy. 57.5% had stage 1A1 or 1A2, and 42.5% had IB1 or IB2 cervical cancer. Discussion: women treated with FSS had a significantly higher recurrence rate than patients who had the uterus completely removed. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is ConferenceHype. Stay with us, coverage continues.
Card 30. Luna Vale is covering JCO oncology practice. The topic is racial and ethnic disparities in receipt of guideline-concordant pancreatic cancer care among older adults in the United States. Background: patients racialized as Black experience a higher mortality from pancreatic cancer. Methods: patients 65 years and older with incident PC, racialized as non-Hispanic white, or racialized as NH Black, or of Hispanic ethnicity, were identified in the SEER Medicare database from 2004 to 2019. Results of 12,772 patients included 85.5% of patients racialized as NH white, 7.8% of patients racialized as NH Black, and 6.8% of patients were of Hispanic ethnicity. Discussion: approximately half of an insured population with PC receives GCC, highlighting a need to improve multidisciplinary access and treatment.
ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
Card 27. Grant Ivy is covering JCO oncology practice. The topic is daily patient-reported symptoms as predictors of unplanned healthcare encounters during chemotherapy longitudinal observational study. Background: chemotherapy can cause symptoms that impair quality of life and lead to unplanned healthcare encounters such as emergency department visits and inpatient admissions. Methods: we recruited patients receiving cytotoxic chemotherapy for solid tumors into our 90-day study. Results: on days with moderate to severe symptom levels, the odds of having one or more UHE within 7 days were 4.53 times higher for vomiting, 2.84 times higher for decreased appetite, 2.5 times higher for shortness of breath, 1.76 times higher for diarrhea, 1.65 times higher for fatigue, and 1.58 times higher for pain relative to days with no to mild levels of that symptom. Discussion: specific daily symptoms were associated with increased risk of subsequent UHE during chemotherapy.
This is Conference Hype. Stay with us, coverage continues.
Card 26. Elena Park is covering JCO oncology practice. The topic is teaching communication skills and developing comfort with difficult conversations, a combined palliative care oncology simulation session for hematology oncology fellows. Background: ASCO strongly endorses the integration of palliative care to improve outcomes and support patients in their cancer trajectories. Methods: we designed and piloted a didactic simulation session for each fellowship class, led by a faculty member who is dual board certified in medical oncology and hospice palliative medicine. Results: in Year 1, 16 of 21 fellows completed pre- and post-sim surveys. Discussion: tools. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
From the July 2026 edition of British Journal of Cancer, this journal review looks at efficacy and safety of a novel oral antivasculogenic mimicry agent, CVM-1118, in advanced, well-differentiated neuroendocrine tumors, a phase EA trial. Background: highly vascularized neuroendocrine tumors are attractive targets for foslinanib, which disrupts vasculogenic mimicry and induces apoptosis via tumor necrosis factor receptor-associated protein 1. Methods: patients with grades 1-2, well-differentiated lung, gastrointestinal, or pancreatic NETs, refractory or intolerant to one or more standard therapies, and progressing within 6 months, received CVM-1118 in 28-day cycles. Results: of 43 enrolled participants, 35 were efficacy evaluable, most had grade 2 pancreatic or gastrointestinal NETs with 2 prior therapies. Discussion: CVM-1118 demonstrates favorable efficacy and safety in advanced NETs.
This is Conference Hype. Stay with us, coverage continues.
From the July 2026 edition of British Journal of Cancer, this journal review looks at oligometastatic neuroendocrine tumors, characteristics and prognosis. Background of this retrospective analysis was to evaluate characteristics and prognosis of the OMD state in patients with NET G1, G2 of gastroenteropancreatic origin. Methods. The primary objective of this retrospective analysis was to evaluate characteristics and prognosis of the OMD state in patients with NET G1, G2 of gastroenteropancreatic origin. Results. The overall study cohort comprised 190 patients. Discussion. These results suggest that a low absolute number of metastases alone may not be a clear prognostic factor in NET. This is Conference Hype. Stay with us, coverage continues.
Conference Hype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. Conference Hype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
From the July 2026 edition of British Journal of Cancer, this is a review covering revisiting retinoic acid in AML therapy, Mechanisms of Action and Rational Combination Strategies. All-trans retinoic acid, a bioactive vitamin, a derivative, regulates cellular differentiation by activating retinoic acid receptors. While ATRA has revolutionized acute promyelocytic leukemia treatment, its efficacy in non-APL acute myeloid leukemia remains limited due to intrinsic resistance mechanisms, including aberrant epigenetic states and signaling pathways. This review summarizes recent mechanistic and translational advances in ATRA-based combination therapies that target differentiation. This is a good review on the topic, well worth reading in full in this issue of British Journal of Cancer. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X. From the July 2026 edition of British Journal of Cancer, this journal review looks at functional and omics-based rationale for the induction of BRCA by androgen receptor pathway inhibitors to sensitize prostate cancer to PARP inhibition, regardless of HRR status. Background: 2 PARP inhibitors, olaparib and talazoparib, have been approved in combination with androgen receptor pathway inhibitors for metastatic castration-resistant prostate cancer in Europe, regardless of homologous recombination repair status. Methods: we assessed PARP inhibitors alone and with ARPIs in prostate cancer cell lines, metastatic patient-derived organoids, and LN metastatic tissue slice cultures. Results: PARP-ARP combinations significantly reduced survival in LN-CA-P, DU145, and 22RV1 cells, and produced greater cytotoxicity than either agent alone in all models. Discussion: ARPIs induce a BRCA-like phenotype through RAD51 downregulation and enhance PARP sensitivity in metastatic prostate cancer models, supporting combined ARPI-PARP therapy.
This is Conference Hype. Stay with us, coverage continues. From the July 2026 edition of the New England Journal of Medicine, this journal review looks at ianalumab plus eltrombopag in immune thrombocytopenia.
Background: current second-line treatments for immune thrombocytopenia require long-term administration. Methods in this Phase 3 randomized double-blind trial. We assigned, in a 1:1:1 ratio, adults with primary ITP and an insufficient response or a relapse after first-line glucocorticoid therapy to receive ianalumab at a dose of 9 mg or 3 mg per kilogram of body weight or placebo once monthly for 4 months. Results: a total of 152 patients underwent randomization, 50 to the 9 mg ianalumab group, 51 to the 3 mg ianalumab group, and 51 to the placebo group. Discussion: ianalumab plus eltrombopag led to a longer time to treatment failure than placebo plus eltrombopag.
This is Conference Hype. Stay with us, coverage continues.
From the July 2026 edition of the New England Journal of Medicine, this is a review covering advances in multiple sclerosis. Multiple sclerosis is a chronic autoimmune disorder that affects the central nervous system, causing episodes of neurologic dysfunction and often gradual disease progression. The immune system primarily targets myelin, the protective covering of nerve fibers, leading to inflammation and damage, and secondary neurodegeneration is a major cause of long-term disability. Common symptoms include vision problems, sensory disturbances, muscle weakness, balance difficulties, and bladder dysfunction. This is a good review on the topic, well worth reading in full in this issue of the New England Journal of Medicine.
This is Conference Hype. Stay with us, coverage continues.
Conference Hype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. Conference Hype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors.
This is ConferenceHype. Stay with us, coverage continues.
From the March 2026 edition of the New England Journal of Medicine, this journal review looks at angiography-derived fractional flow reserve to guide PCI. Background: assessing intermediate coronary lesions with an intracoronary pressure, wire improves clinical outcomes in patients undergoing cardiac catheterization and percutaneous coronary intervention. Methods: in this international non-inferiority trial, we randomly assigned patients undergoing coronary angiography who were found to have at least one intermediate coronary stenosis to physiological assessment with measurements derived from angiographic images or with pressure wire-based measurements. Results: a total of 1930 patients were randomly assigned to physiological assessment with FF-Rangio or a pressure wire-based approach. Discussion: among patients with intermediate coronary artery lesions undergoing physiological assessment in the cardiac catheterization laboratory, an angiography-guided strategy involving FF-Rangio was non-inferior to a pressure wire-guided strategy with respect to a composite end point of death, myocardial infarction, or unplanned clinically indicated coronary revascularization at 1 year. From the July 2026 edition of the New England Journal of Medicine, this journal review looks at rituximab versus ocrelizumab in newly diagnosed relapsing multiple sclerosis. Background: anti-CD20 monoclonal antibodies are effective for relapsing multiple sclerosis. Methods: in this Phase 3 multicenter double-blind non-inferiority trial, we randomly assigned adults with newly diagnosed relapsing multiple sclerosis and recent disease activity in a 3:2 ratio to receive rituximab or ocrelizumab every 6 months for 24 months. Results: a total of 218 participants underwent randomization, 216 received treatment. Discussion: in participants with newly diagnosed relapsing multiple sclerosis and recent disease activity, rituximab was non-inferior to ocrelizumab in suppressing disease activity as detected by MRI from 6 to 24 months, with a similar incidence of serious adverse events. From the July 2026 edition of the New England Journal of Medicine, this journal review looks at adjuvant pembrolizumab plus belzutifan for renal cell carcinoma. Background: adjuvant pembrolizumab improves disease-free and overall survival among patients with resected clear cell renal cell carcinoma. Methods: in this phase 3 double-blind trial, we randomly assigned participants in a 1:1 ratio to receive intravenous pembrolizumab at a dose of 400 mg every 6 weeks, and either daily oral belzutifan at a dose of 120 mg or placebo for up to 1 year. Results: a total of 921 participants were assigned to receive pembrolizumab belzutifan, and 920 were assigned to receive pembrolizumab placebo. Discussion: treatment with pembrolizumab belzutifan led to significantly higher disease-free survival, with a greater risk of grade 3 or higher toxic effects, than treatment with pembrolizumab monotherapy after nephrectomy in participants with clear cell renal cell carcinoma at increased risk for recurrence.
This is Conference Hype. Stay with us, coverage continues.
Card 28. Talia Stone is covering JCO oncology practice. The topic is role of a designated pharmacist in reducing adverse drug reaction rates and preventing potential medication errors in hematology oncology, a randomized controlled trial. Background: evidence is insufficient regarding pharmacists' impact on reducing adverse drug reactions in oncology. Methods: this single-center randomized clinical trial was conducted at its outpatient hematology oncology clinics from July 2020 to October 2022. Results: the study included 182 patients, 91 in each group. Discussion: integrating an oncology pharmacist into hematology oncology clinics reduces ADRs and improves the detection and prevention of potentially serious MEs. That is it for this segment. If there are any medical conferences or events you want covered, tag our team on X.
This is Conference Hype. Stay with us, coverage continues.
This is Conference Hype. Stay with us, coverage continues.